Hello everyone, Dr. Mike here. Today we're diving into the crucial risk and protective factors for breast cancer. Understanding these can help us better manage and possibly prevent this condition. It's a topic that hits close to home for many, and having the right information is empowering. So let's break it down and equip ourselves with the knowledge to prioritize our health. We're starting off with a significant risk factor: exposure to thoracic ionizing radiation before the age of 30. Now, this doesn't mean every exposure leads to cancer, but studies show a relative risk 22 to 40 times higher in individuals exposed to significant radiation, especially during their younger years when breast tissue is still developing. This increased risk underscores the importance of minimizing unnecessary exposure to radiation whenever possible. Whether it's medical imaging or other sources, understanding the potential long-term impact is crucial. Let's talk about DCIS and LCIS, ductal carcinoma in situ, and lobular carcinoma in situ. These terms might sound intimidating, but they essentially refer to the presence of abnormal cells in the milk ducts or lobules of the breast. While they haven't spread to surrounding tissues yet, having DCIS or LCIS significantly increases the risk of developing invasive breast cancer later on. That's why early detection is key. Regular mammograms and checkups can catch these abnormalities early, allowing for timely intervention and potentially preventing progression to a more serious stage. Our genes play a significant role in our overall health, and that includes our risk for certain diseases like breast cancer. Specific inherited genetic mutations, such as those in the BRCA1, BRCA2, TP53, ATM, and CDH1 genes, are known to significantly increase the likelihood of developing breast cancer. These genes are involved in crucial cellular processes like DNA repair and cell growth regulation. When these genes are mutated, these processes can go awry, increasing the chances of cells becoming cancerous. Atypical hyperplasia, another term we'll clarify today. This refers to an abnormal increase in the number of cells in the breast tissue, often identified through a biopsy. While not cancerous in itself, atypical hyperplasia indicates a higher risk of developing breast cancer in the future. Think of it as a warning sign that things aren't quite right. It's crucial to discuss with your doctor the appropriate follow-up and monitoring strategies if you've been diagnosed with atypical hyperplasia. As we age, our risk for various health conditions can increase, and breast cancer is no exception. The older we get, the higher our chances of developing this disease. While we can't control the hands of time, understanding this risk factor allows us to be more vigilant with screenings and proactive about our breast health as we grow older. Regular self-exams and consultations with your doctor become even more crucial in these later years. Family history plays a significant role in understanding our risk for various health conditions, and breast cancer is no exception. Having multiple first-degree relatives, that's your mother, sister, or daughter, diagnosed with breast cancer significantly increases your risk. This familial connection often points to shared genetic factors that might predispose individuals to the disease. If you have a strong family history of breast cancer, it's crucial to discuss this with your doctor to determine appropriate screening measures and risk-reducing strategies. You might be surprised to learn that a family history of early-onset ovarian cancer, particularly in women younger than 50, can also increase your risk of breast cancer. This link highlights the interconnectedness of our bodies and how certain genetic mutations can increase the susceptibility to multiple types of cancers. If you have a family history of ovarian cancer, even if it doesn't run in your direct maternal line, it's essential to inform your doctor to assess your individual risk factors accurately. Having a personal history of early-onset breast cancer, particularly if diagnosed before the age of 40, unfortunately increases the risk of developing breast cancer again in the future. This risk underscores the importance of long-term monitoring and follow-up care for breast cancer survivors. Regular checkups, screenings, and maintaining a healthy lifestyle are crucial in managing this risk and ensuring early detection if the disease were to recur. Hormones play a significant role in breast cancer development, and after menopause, high levels of estrogen or testosterone can increase the risk. These hormones can fuel the growth of certain types of breast cancer cells. Understanding the impact of hormone levels is especially important for postmenopausal women, as it might influence treatment decisions and lifestyle recommendations to manage their risk effectively. While motherhood is a beautiful journey, having your first full-term pregnancy after the age of 35 has been linked to a slightly higher risk of breast cancer. The reasons behind this association are complex and not entirely understood. One theory suggests that the longer exposure to estrogen during a woman's reproductive years might play a role. However, it's important to remember that this is just one of many factors, and it shouldn't discourage women from starting families later in life. Did you know that breast density can provide insights into your breast cancer risk? Women with very dense breasts, typically defined as having more glandular tissue than fatty tissue, tend to have a higher likelihood of developing breast cancer. This is because dense breast tissue can sometimes make it more challenging to detect abnormalities on mammograms. If you have dense breasts, talk to your doctor about additional screening options, such as ultrasounds or MRIs, to ensure comprehensive monitoring. Even having one first-degree relative diagnosed with breast cancer can elevate your risk compared to someone without a family history. While the increase in risk might be less pronounced than having multiple affected family members, it's still essential to be aware of this connection. Open communication with your doctor about your family history is crucial in personalizing your screening plan and making informed decisions about your breast health. Proliferative breast diseases, a group of conditions characterized by excessive cell growth in the breast tissue, can increase the risk of developing breast cancer. One example is atypical ductal hyperplasia, which we discussed earlier. These conditions highlight the importance of regular breast exams and screenings. Early detection of any abnormal changes allows for timely intervention and management, potentially preventing progression to a more serious stage. In addition to the previously mentioned gene mutations, variations in genes like CHEK2 and PTEN can also impact breast cancer risk. These genes are involved in DNA repair and cell cycle regulation, and mutations can disrupt these processes, increasing the likelihood of uncontrolled cell growth. Genetic testing can be a valuable tool for individuals with a strong family history of cancer, or those who want to understand their personal risk factors better. Now for some positive news. Breastfeeding, in addition to its numerous benefits for both mother and baby, has been linked to a reduced risk of developing breast cancer. Studies suggest that breastfeeding might delay the return of regular ovulation after pregnancy, leading to lower lifetime exposure to estrogen, a hormone that can fuel certain breast cancers. Furthermore, breastfeeding is believed to promote the healthy development and differentiation of breast cells, potentially reducing the risk of abnormal cell growth. Today we covered some of the most significant risk and protective factors for breast cancer. Remember, knowledge is power. Regular checkups and consultations with your healthcare provider are crucial. By understanding your individual risk profile and staying proactive about your health, you can make informed decisions and prioritize your well-being.